Good afternoon, everyone. Welcome. I am going to wait for another minute or so before we get started. But as you are joining us, please take advantage of the chat and share who you are. You can provide your name and affiliation. We would love to see who is here. Okay, I will get started. So welcome, everyone. Thank you for being here today. We are going to be enjoying our time together to talk about documenting adaptations before, during, and after the implementation of evidence-based programs. We are very grateful that you decided to spend a little time with us today on Friday. And this program, this workshop, is co-sponsored by the 3Rs UCLA IS Hub, which is directed by Dr. Allison Hamilton, and the San Diego CFAR IS Hub, which is co-directed by Dr. Nicole Stednick and myself. I am very delighted today to be here co-presenting with Dr. Russ Glasgow and a special guest to whom I will introduce you in a moment. We will be using the chat to communicate with you primarily today, so please take advantage of it throughout the presentation. Add your comments, ideas, questions. We hope that we can maintain bidirectional learning through that. We will not be able to have deep discussions back and forth, but I think the chat will be a really nice way for us to interact. So please get started on that. There will be some times when we stop and look at the chat, and then we will be looking for your comments. We will be recording this session and make it available to a larger audience, so just be aware of that. To my understanding, your face is not going to show up on this recording. We had some wonderful technical assistance on making this as private as possible. So as you are joining, please put your name and affiliation into the chat, and we will get started here in a moment. Let's start with introductions to our workshop team. We have a larger team with us, but 3 of us are going to be primarily presenting. My name is Borsika Rabin. I am, as I mentioned, the co-director of the IS Hub in San Diego. I am also faculty at the Herbert Wertheim School of Public Health at UC San Diego and an implementation scientist. I co-direct our UC San Diego Dissemination and Implementation Science Center. And I have been very lucky to be working with Russ for the past 16 years, Russ. I had to think about that. So Russ, I would like to invite you to introduce yourself now.
Okay, if I can find the mute. Afternoon, everybody. Looking forward to this. I'm the director of the Dissemination Implementation Science Program at the School of Medicine, the University of Colorado, and a research professor in family medicine there.
Thank you so much, Russ. And as I mentioned, we have a special guest today, Dr. Erin Finley, who is affiliated with the UCLA Rapid Rigorous Relevant IS Hub. And she will be speaking about one of the special methods that you can use to document adaptations. Erin, may I have you introduce yourself?
Thank you so much for having me as part of this. And I think you've already done a great introduction. I'll just add that I'm an implementation scientist, medical anthropologist by training, and I am with the Center for the Study of Healthcare Innovation, Implementation, and Policy at VA Greater Los Angeles, and also direct the Dissemination Implementation Consultation Core in the Center to Advance Community Health at UT Health San Antonio. So really delighted to be here.
Thank you so much. We all are very grateful for everyone who made this particular workshop possible. More specifically, the 2 hubs have amazing staff, including Elena Rosenberg-Carlson, who is our Zoom guru today and the organizer of the meeting. Thank you so much, Elena. And then from San Diego, Claire Villion and Kelly Kane have been really wonderful in helping us get ready for this workshop. In addition to that, the content that we will be presenting is, of course, collaborative content with a lot of different colleagues from around the US. And specifically, we wanted to call out our colleagues in the Denver VA. Russ and I have been working with them for many, many years, and you can see some important names here who have been contributing to the co-development of these methods. And then also some of the content will be based on my work with the Axis Moonshot funded UC San Diego U project that is co-directed by Elena Martinez, Samir Gupta, and Sheila Castañeda. And I will be sharing some content from that project as well. And you can see some funding acknowledgements here as well. So what are our plans for today? The workshop is primarily focused on documenting adaptation. So we will talk about terminology briefly. Then we will move into thinking about how we document adaptation. Specifically, we will ask the questions of why, when, what, how, and who. And we will look at some possible methods that you can use to achieve this goal. Then we will talk a little bit about how we analyze adaptations and understand their impact. And we will have opportunities to discuss some issues with you. When you were registering, you already provided us with some great questions. We will continue collecting those throughout the session and come back to you. And we will be sharing some resources as well. Unfortunately, today's session will not be able to focus on everything related to adaptations. So I wanted to immediately let you know that today we are not going to necessarily talk about how to adapt programs in the pre-implementation phase or how to adopt them on an ongoing basis iteratively. We have some other presentations and there are some other wonderful resources addressing that. We are not going to get into the detailed guidance on different techniques of analyzing documented adaptations or understanding the impact, but we will be sharing with you some resources where you can find more guidance on that. So as I mentioned before, Elena programmed in a question to the registration when we asked you what is that you would like to learn today from this workshop. And we have recorded those and looked at those. So some of those are already incorporated in this presentation. But this is another opportunity to those of you who might have not shared your interest to tell us what is the most burning question you hope to get answer for today about documenting adaptations. And please put this into the chat. I will try to be technically savvy and just pull up my chat and see whether some are coming in. We will be looking at these as we stop for different discussion points, but if you have any selection of readiness assessments, should we plan to document, what level of detail about adaptation should we plan to document? I will wait a few more seconds here. Any other burning questions? How do we justify what we select to measure? How to work with community partners, I assume around adaptations, standardizing reporting, how do we go about it? Very good questions. Some of these are going to be already covered, others we can come back to. Using intervention mapping with adaptation, hoping to publish at some point want to make sure that nothing is missing in the process. How long should you track adaptations? Great question, thank you. Systematic methods for summarizing adaptations, how to integrate equity to capturing adaptations. Super questions, thank you. I will stop reading these, but I am not going to stop recording this, so please continue adding your ideas here. So let me start with a very brief definition of adaptations, and perhaps this is kind of a statement from primarily Russ and I of how we think about adaptations in our work and how we will use this terminology in this particular workshop. There are a number of wonderful definitions. Some of them are more sophisticated and detailed than the one that we are using, but generally the way that we have been conceptualizing adaptations in our work is to think about any change or modification to the intervention, the implementation strategy, or the context where the implementation happens. And honestly, we have also been tracking adaptations or changes to our research processes because we thought that that's helpful. When we think about adaptations, the main concern is to improve the fit of the intervention or the implementation strategy to a given context, whether it's a population or setting or a combination of that. These adaptations, we believe, are common and not evitable. And it is, though, good to acknowledge that we have concerns around adaptations changing effectiveness. So that's certainly a major concern that we often hear when we talk about adaptations. Is it going to be now a non-effective intervention that you change certain components? Another piece that is not listed on this slide is concerns around designs. If we allow adaptations beyond the pre-implementation phase, what does that mean in terms of our designs and what we measure? What are we actually assessing at that point? So all of those concerns we will try to talk about, but they are very valid concerns about adaptations. This slide, I just wanted to remind us that historically, when we thought about adaptations and Fidelity, often Fidelity was seen to be the good guy who needs to be maintained or sustained as much as possible. And adaptations were seen as problematic and often described as deviations to the protocol. There is certainly a great tension between fidelity and adaptations, as it is between external and internal validity. And I think that the field has transitioned over time to a little bit more mature view of fidelity and adaptations. It's a newer version of this visual where we brought in some female super characters, showing that perhaps the collaboration between adaptation and fidelity, both together, can result in sustained, successful implementation. So we will be thinking about this need for balance. And a slide from Dr. Anna Baumann, a wonderful colleague, and I apologize, I have an N missing there, talking about this notion that adaptations are not good or bad, they just happen, and they are actually necessary for us to create a fit. In fact, if we ignore adaptations, least we are not going to fully understand what was implemented and what we measured. At worst, it will lead to implementation failure. So we will not be successful in implementing a program. And there are some great publications from Dr. Baumann and colleagues around these issues. So why would you want to document adaptations? We kind of perhaps came to the agreement that adaptations will happen. We want to allow them to happen, but why do you want to document them? And here are some reasons, and I will just pick out a few of these, or perhaps we'll go through the full list. So one reason might be that you want to be able to have an organized list of adaptations for future implementers who would like to understand what might lead to success. We also want to provide a contextual process data to interpret outcomes. So understanding what was actually implemented and what kind of changes were made to the intervention and implementation strategy will allow us to measure what actually happened on the ground. We also can use documented adaptations to refine our interventions and implementation strategies during implementation or after. We might refine existing frameworks or measurement approaches based on understanding adaptations. We can anticipate and describe the impact of adaptations. This is an important next step for the field. We want to develop and replicate easy-to-use documentation method for adaptations. And we want to be able to also investigate the relationship between adaptations and other factors like context, subgroups, and time. And finally, I just added this last one, as we are making some attempts within our work in the Moonshot Initiative, the AXIS project, the Accelerated Colorectal Cancer Screening and Follow-up through Implementation Science, to look at adaptations across multiple programs within an initiative. So being able to see how a similar kind of intervention was changed across these different programs. So now it's for you. Elena, I would like to ask your help. We have two poll questions for you, and Elena is going to make it possible for you to respond to those. The first one is asking you about your documenting adaptations practices. How are you documenting adaptations in your current projects? And the options are not documenting, pragmatically documenting, or systematically and comprehensively documenting adaptations. And I see already responses coming in. I will give you a few more seconds here to see. So what I see so far, and we can run it for another 5 seconds, and perhaps Elena can share the results. Thank you so much. Elena, you are sharing it. Wonderful. Thank you. So you can see that there is a prominence in pragmatically documenting adaptations. About 63% of those who ended up responding said that they are using a pragmatic approach. About 18% said not documenting, and 20% systematically and comprehensively documenting. This is very helpful. Thank you. And then we have a second question that is related to fidelity. So Elena, if you could make that available. And it is asking you to choose how you are documenting fidelity in your projects. Again, your options are not documenting it, pragmatically documenting it, or systematically and comprehensively documenting fidelity. And again, answers are coming in. Very interesting. We'll give it a few more seconds, getting about to the same level with the other. Super, thank you so much. So what you can see here that we have a closer kind of even split with not documenting, pragmatically documenting, and systematically documenting fidelity. Very, very interesting. I will be interested when Russ comes on what he thinks about it and others as well. Okay, we can move on. I will be able to, I think, close this without harm. So let us move into actually talking about what can you do to document adaptations. This approach we chose is this when, what, who, and how for the documentation of adaptations. And let me start with Russ's favorite slide. And he says that he doesn't get out too much. That's why this is his favorite slide, which I just loved. And the reason why I think Russ likes this slide and I like it, because it's relatively simple and I think intuitive. Talking with our colleagues, it made sense to them. And this is really perhaps the most simple way that you can think about adaptations. We will show you some more sophisticated approaches as well, of course. And this visual shows you the what I already shared, that adaptations can happen to interventions, implementation strategies, and context. And the timing of adaptations are potentially before implementation, so pre-implementation, during implementation, and following implementation or during sustainment. And so as you very simplistically would like to think about documenting adaptation, you could use this grid and start to write in the changes that happen at these different time points to these different types of components of your program. Of course, the devil is always in the detail, and so we will tell you a little bit more about these. But if you want to organize your adaptations, you could start by this very simple approach. One thing that I would like to make sure, and it's a major question that we get when we think about adaptations, is are we on the same page with those who are thinking about adaptations and the research partners? And I think that what I mean here is that we want to be sure that we all agree on what the intervention and the implementation strategies are. Often that's a basic, very simple question that is not clear. And when we start to think about adaptations, people start to ask us, well, adaptations to what? What is the baseline? And so this is an example from the Axis San Diego study where we laid out very clearly of the different components of the intervention. And there are two components here, the male fit component and the abnormal fit follow-up, and made it very clear that this is what we envision the intervention will be. And then as you are thinking about adaptations, share with us everything that is different from what you see here. Of course, often you have to get even more detailed and explain what you mean by automated call and text message reminders or patient mail fit kit to clinical reference lab. But a shared understanding and providing a very clear visual or some form of description of what the baseline is for the intervention and the implementation strategy is very important to be successful in tracking adaptations. And ideally, as this intervention and implementation strategy iteratively change, you would want to provide the updated version of it so people can think about the new baseline as they reflect on adaptations. Of course, it's very challenging and often hard to separate out core components and discretionary periphery or the intervention from the implementation strategy, which are both questions we get when we are starting to think about adaptations. A common guidance is that you should make changes to discretionary components and not to the core components, but identifying which one is which is not always straightforward. it is always often a question, which part belongs to the intervention and which to the implementation strategy as you are thinking about adaptations. And again, especially in clinical or public health settings where these two components overlap, it is not always straightforward. So a few ways where you can start to take these apart might be to use a logic model. And here I am sharing an example of a really nicely developed logic model from our colleagues, Dr. Smith and Dr. Blumenthal from the San Diego CFAR, where they use the implementation science logic model developed by J.D. Smith and colleagues to describe their intervention and implementation strategies for their work. I will say this is not version 1 of their logic model. This is about version 33, but throughout the process, they were challenged to think through the different components. And so tracking adaptations after having a more detailed understanding of the process and the program can be very helpful. Similarly, another approach that we have been thinking about and trying to use in our own work is the work published by Dr. Monica Hoyes Perez, wonderful colleague of ours, thinking about distinguishing core functions and forms of your program. Core functions being the key elements that you need to deliver within your program, and forms are the different shapes that that core program might take depending on the context. This distinction can be very helpful as we think about which components we want to maintain and which components we allow tailoring or adaptations to. And you can find a really nice example in her publication cited below here and much more detail about this concept. So let me talk a little bit about how you can collect information about documenting or document adaptations. This is not a comprehensive list, but these are some methods that you might consider using to gather information about adaptations. Interviews, and we will talk a little bit more about that, periodic reflections, and Dr. Finley is going to tell you much more about that today. You might use direct observations, real-time adaptation tracking database, and I will share a little bit more on that. You might use actually reminder emails to your research team. Contact logs and field notes might be great source for adaptation data. Some very low burden way to find adaptations is looking at meeting minutes or agendas or calendar entries to see whether changes have happened to the program in discussions. Electronic health records might be a good source if your program is clinically inclined. Informal check-in with partners, often just simple questions included in your regular check-ins can be very helpful. Member checking for missing adaptations and accuracy we found is critically important. So once you have this information, you want to go back to the different partners in your team and make sure that you didn't miss any of the adaptations, or the way that you conceptualize them is correct. In our project in San Diego with Dr. Stednick, in our COVID-19 project, we are using this approach right now to make sure that our current list is comprehensive. Process maps, and I will show a little bit about that, and your methods. So please use the chat to add some of the methods that you have used in the past or currently you are using to document information about adaptations. And I know that there might be some questions and we will be stopping in a moment. So please hold it or put it in the chat and then we will get to those. Thank you so much. So a little bit more focusing on a few of these methods. The first one is interviews. We have an interview that we developed, actually Ross's group developed when they were doing a retrospective assessment of adaptations in the patient-centered medical home-based interventions. And then we adopted this for our VA work. This is available through a publication, and we just recently posted it because it was not electronically available anymore on our DISC website. So the link that is provided here will take you to that interview guide, and you are welcome to use it and adopt it. This was about a 45-minute interview when we did it in full, and often that's not a luxury that many of us have to be able to do specifically 45-minute interviews on adaptations. But you can pick a few sub-questions and include them in general implementation interviews to ask about adaptations as a low burden version of this. periodic reflections, again, it is going to come back to you, is our method and focus section by Dr. Finley. And in the real-time adaptation tracking database is the last one I am going to focus in on. This is a method that we have been using in multiple of our studies now. It is based on using a REDCap database or another type of database. We have been using REDCap primarily. This is a Word version of what the database looks like, a starting point of it from our AXIS project, where we have a set of variables that we assess and then enter into the REDCap database. The information is coming in from different members of the team. We have a bridging partner between our healthcare center and the research team. So they are providing adaptations. We have our research team members who have different roles on the project, and they might be familiar with these. And our wonderful project manager sends out regular reminder emails to ask the team whether there were any adaptations. Based on those emails, this more detailed adaptation form is filled out, and the data is entered into the REDCap database real time, which is usually not immediately, but within a few weeks from the adaptation happening. And this is the REDCap version of this. In the past, we have shared different versions of this with colleagues, so please get in touch with us if you are interested to learn more. This method is also used in our VA study and then COVID-19 study with Dr. Stadnik. And then I didn't tell the truth. We have also the process maps. This is an interesting method that we have been using in the VA project with Marina McCrate's leadership. In these projects, they have created really beautiful process maps of their interventions. This is specifically the ACC Care Coordination Project that is led by Dr. Battaglia. And we use these process maps, which are redeveloped in every few months, to look at changes. So here you can see a map and then a follow-up map. And what we did is simply looking through, and we have about 20 maps for this one project. We went through each map and looked at the difference between the two maps, very simply circled them. Actually, I did it on paper and used a pencil to do this, and use these changes to identify additional adaptations. So if you are already doing process mapping, you can use those changing process maps as a source of adaptations. And then at this point, I am going to hand this over to Dr. Glasgow.
But first, we're going to pause for some questions or discussion, right? So
that is correct. Thank you. Perhaps I will stop sharing and see whether, Russ, you picked up any questions from the chat.
I just would like to elaborate a little bit, realizing this could be a whole discussion or a whole multiple day workshop in and of itself. But the really good question about how do you tell when something's fidelity, consistent or inconsistent? Conceptually, this is really important. And I just want to emphasize one or two things that Borsika mentioned, and then add to it a bit and invite your comments too. Particularly where I was impressed with the number of you that are systematically documenting adaptations. So we'd like to learn from you too. This is very much a work in progress. I want to emphasize that. From my perspective, nobody has this worked out, at least at this point in time. But to me, where you start is one of the things, and often starting to think about the intervention so that you really understand that you understand both its conceptual, theoretical basis. And then usually it's helpful, not always, but like to talk with I think the developer, if you will, of the intervention to make sure you understand the key parts. It's the easiest if you have a, quote, manualized intervention, which talks about specific protocol things. But for many of us, like in our experience, we hardly ever have that. So I think what we often end up using is some version of this form and function approach that Borsika has talked about. We really find it helpful to try and differentiate, is an adaptation changing, the core purpose, the key goals, what you want to do, the project, what many people call core components, or is it really just a change in the specifics, the form of how that's done, like who calls? Okay, the notion might be it's important you have a contact, but whether the nurse calls, or the navigator calls, that sort of thing is probably not a change to the function, but rather the form, or maybe even if it's a phone call versus a text message. So I just wanted to start that, but again, maybe either Borsika or others, maybe Erin or Nicole, anybody wants to jump in here too, because it is a great question that, from my perspective, doesn't have a perfect answer.
I agree, Russ. I don't think I have anything to add, but I would love to hear from others if they are willing to come on. And I'm also looking at some other options. Erin?
The only thing I was going to say is I agree. And I'm just so glad we're having this conversation, because I think it's a conversation as a field we really need to be having. But for me and our teams, we often just think about it as core components and menu options, because people can kind of get their head, the form functions is so beautiful, but it can take a little while to get your head around. But menu options, people go, oh yeah, okay, it's this,
Yeah.
that, or the other, and this works here and that'll work there. And blah, blah, blah. But no, it's a wonderful conversation. Thank you so much.
Okay, have any of you noticed any other issue in that? There's a couple things that we are going to get to later on, but anybody else notice that are helping us monitor the chat? Either Borsika or Nicole, anybody, Claire, Elena, you notice anything else that we should talk about now?
Rebecca had a question, I think. If Rebecca, you would like to ask that, please go ahead.
Oh, there we go. Hello to you both. So very nice for you to present this. So I'm working on a project right now that involves delivering an evidence-based program to a group. And when we first designed this study, it was going to be an innovation that we were delivering this innovation via telehealth. We designed this and submitted and got the project funded in 2019. And by the time we are now today delivering this, it's actually pretty commonplace. So the question I have is, there's some elements of the group itself that I think of as core component, the fact that it's a group of 8 to 12 people. And so now my question is, what if the group is 4 people? What if the group is 15 people? At what point do we say that we are not delivering with fidelity because the group size has changed? The recommended size of the group is 8 to 12 for this particular intervention. So I appreciate if you would comment on the fuzzy area.
Well, what a great question. I think that this is one of those where I start to think about that the adaptation itself, as you describe it, might not be meaningful enough. You have to start to make sense of it. And, the 8 to 12, how did you come to that choice? What kind of theoretical or experiential reason you chose that range, and what do you expect to change as a result of this larger or smaller group in terms of the impact of the intervention? So for me, that would be a very important discussion to understand the potential impact of this change on the effectiveness of the intervention or the delivery, feasibility, etc., and make sense of the adaptation that way. That's where I think just writing down what the change is not sufficient to understand the impact or the importance of the change. Russ, what do you think?
Borsika and I have worked together too long, because I say almost exactly the same thing. Usually, maybe just to elaborate a little bit, I guess my first question I would ask, slightly paraphrasing Borsika, is what's the purpose of the 8 to 12? And how did you arrive at that? Like, for example, I'm just going to make this up. Maybe it's important to make sure you hear from all the key different perspectives that you have there. So like all members of the team, you need to have the key decision maker, maybe about funding. You need to have the person that's in charge of the unit. You need to definitely have the direct implementer. Maybe it's really important to have good patient voice. So do you have that? Then that might help you judge that. But from my perspective, like you might think significant things, like if you're cutting by half or something, is pretty important. If it changes from 11 to 12, usually probably not so much, maybe, unless the key role of the person that you're adding or subtracting really changes.
So are you saying, Russ, that it depends?
We'll try not to give too many insider jokes or quips here, but as Borsika and some of you know, that's my favorite answer to everything, because it does. And primarily it depends on the context, but often that's not helpful, particularly when you're trying to get into a new area to hear that. So
let me check, Russ, if Nicole or Claire had anything else to quickly contribute.
I love what you're both saying, and I would also add a slightly nuanced "it depends" response to that, in that with this group size, I might also just think about pragmatically, if you're still able to deliver the content appropriately, then maybe the size is not as important, and it could be a testable question. Do you still see the same benefits or outcomes with a smaller group versus a larger group? And that could be a really important contribution to the research practice space that you're in.
that's a great point, Nicole. Thanks for entering that in. It also presages something that I'm sure we're going to talk about later, and that's the outcome or assessing the impact of adaptations, which is another sticky wicket or wicked problem or work in progress, but another key issue. So thanks for raising that. Maybe I should go ahead, Borsika, just to make sure that we can cover the key things, then still have time for other issues. So this is another of my favorite slides that we call kind of the funnel chart here. And the notion, as Borsika said, and a number of you liked, I noticed that there are lots and lots of options to decide from. And through some combination of thinking about what's best to fit your project, going to give you the most information, frankly, often what you're most familiar with, the staff resources that you have, and I'll show a slide on that later, you decide about a combination. But the bottom line is listed at the top line here, and that is that multiple methods, we just strongly can't emphasize that enough, are almost always there. There's no magic number, but again, at least 2, and often we find like 3 different methods are helpful to kind of triangulate in. And again, Erin can probably elaborate or explain that in detail better than I can here today. But we really like this about you put these together to get a fuller picture, and then ideally to integrate these so that you're really doing mixed methods. Okay, learning from forcing each other, getting a fuller picture rather than just multiple methods in parallel. But any given one, has strengths and limitations. So next slide, please. Okay, so as I said here, lots of decisions and lots of options to make here. One of the first ones is who collects the data about adaptations and their pros and cons. My own bias is I think that often, if it's possible, or for some type of adaptations, if the implementers or the implementation partners are actually able to collect those, that can be really informative, especially to get their perspective. Sometimes, though, it's hard, or they aren't trained. If we really want to do some precise coding, it may not be difficult. They may not have the time or the detailed training to do it. So we may want our research team to do that. I think in the future, maybe one of the future directions is if there can be some more automated things or unobtrusive assessments there. Then similarly, from whom do you collect data on adaptations? Bottom line, I won't read all of these here, but the notion is that to consider for a given project, what are the key different perspectives that you need to know about and consider specifically for, like, after this project, if you want to think about either sustainability or broader dissemination, kind of from whose perspective do you understand that? And then finally, at the bottom, it's a real challenging one. Borsika and I are just working now with a current project here to think about, and there's almost always a balance between, ideally, I mean, from a research perspective, you'd really love to have this real-time data. That's hardly ever possible, okay? And you just need to think about your project, what is feasible to balance this, if you will, precision, reliability, validity issues with burden and what's realistic. The other thing is, I think the key thing is how long is the project going on. I think it's probably more important if you have a 3-month project to try and collect, say, at least weekly. But if you've got a 2-year-long project, probably that's either not feasible or not that informative later on. Next slide. Okay, so another one of these choices here about what to collect data on. Here, there have been more examples that I'm going to show in the next couple slides for choices, but usually we can't collect everything or assess everything. That's too burdensome. So it is important a priori to think about it. I'll just mention a couple of my favorites, and then the next couple slides, there will be a more conceptual approach or some frameworks for doing this. But to me, it's starting in the top left, this notion of the type of adaptation. You know, why was that done? I think over in the right-hand column, this notion about both who provided the information and who initiated it is really important to think about, you know, from a team science perspective there. We'll come back to, at the bottom line there, issue of impact. But I also think this notion for me about why was the adaptation made, then parallel, what impact did it actually have, is really, really critical. And especially that's one of the things, seeing the chat, and we're going to talk later about equity impacts too. But I think that is really essential there to think about the purpose of this. Was it actually, you know, to increase, to get more representativeness or not? What impact did that adaptation actually solve that problem, or did it potentially exacerbate inequities? So next slide. So this is one of, I think still today, this is probably the single most frequently used framework. I appreciate both others' comments on that. And then after I show you the next couple slides, if you've used different ones that you found helpful, I'd appreciate that. But the notion here, remember Borsika started out by saying we're going to talk about who, what, when, why, and how. And so the frame developed by Dr. Wiltsley Sturman, Anna Bauman, Chris Miller, colleagues here, is I think a really helpful way to systematize a lot of things that were going on. From my own perspective, this is really helpful, and it's moderately burdensome to do. I think it works really well generally if you have research staff doing it. For others, it's sometimes difficult to do, and it may also depend on the modality. I will also say that my own bias, this notion that is kind of called out at the very bottom about reasons for it, the adaptation, I think is really important in terms of understanding this or thinking about future use as well. Next slide. So as many of you know, FRAME was developed originally to look at interventions. So what adaptations were made to interventions? The FRAME IS is to take many of these same concepts, but to think about adaptations to the implementation strategies that are made. And so they've incorporated lessons learned, but with a new frame, thinking about implementation strategies here. Several we don't have time to get into, but several of these are the same, as you can see there, about, you know, what is it that's modified, you know, the nature of it. Again, top right-hand side, if you can see, what is the goal? But again, the starting point, as we talked about before in the top left, is what is the evidence-based program that you're doing, and really need to understand that. That's kind of the what, and then the how you deliver that, the how, is what we're tracking with the FRAME IS. The other thing about this that I think is very helpful is they do have some strongly recommended or required modules that they have here, and then they have some other optional ones that aren't shown here. And I think if you have to make a forced choice, that's a real helpful guidance. Next slide. Okay, so what do you want to think about? Most of these are just a synthesis of our own experience. I don't know exactly how you'd empirically test these, but thinking about how successful your adaptation assessment is going to be, thinking about what you're going to learn, what you're going to be able to report. I'm not going to read all of these, but you can kind of work through them on your own. But I'll just point out a couple that I think are really important. Understanding what they are, and again, I think kind of with the purpose in mind of coding, that's really important. In terms of the start, Borsika and I think it's really important to think about at least 3 phases, or like in EPIS, 4 phases about doing that, but beginning to be sure you capture initially the things that are made very early on in the planning stages, or even, the pre stages, versus those that are done during the rollout or while you're implementing. And then we also feel it's especially important to collect adaptations that are made either just before sustainment to inform that, or during the sustainment period. So again, back to that, Borsika called my favorite slide the kind of 3x3 matrix. I think that's really important. Use, again, to beat a dead horse there, multiple methods. I think if there was one thing we had to leave you with, it would be the importance of multiple methods. Explore, I think, this notion of over time, longitudinal methods over time is really important. And then verify, I also think too, because it's tough to have an exact validity check, but I think going back to member checking and that sort of thing is really useful there. It also helps, I'm not quite sure where it fits in here, but I think to pilot it and try and make sure that you get some consistency in the coding early on among whomever the coders are going to be. Next slide. And Borsika, in general, am I doing okay, or am I doing like usual, too many tangents and getting us behind schedule?
I think it's perfect.
Okay, so perfect was the magic word that you heard there. You're never gonna be able to do everything. And again, it's this constant tension, I think, okay, between burden and being realistic, and then, doing the total comprehensive job that maybe a real critical reviewer might want to see. But I think being pragmatic here, and we'll talk about some more examples of that, it's really the key. It's that balance, So again, you don't know what you don't know, but you want to, based on experience, thinking about reporting, thinking about the intervention you have, what's likely, to be the key things that you're going to know that you want to do after the study's over to act on. Next slide. Okay, so this one already came up, and it's one we struggle with all the time on every project, is what should you document and what can't you? You drive yourself crazy if you documented every single thing, that went on in a project, but you definitely don't want to miss key things either. So some guidelines that we've used, and again, you kind of look for the combination of these, are important things, I think, is to consider the potential impact. And by that, we mean in the right-hand side. I will read all of those bullets. I think they're important there, okay? Is this, from what you know, okay, likely to have an impact on either the implementation or the effectiveness outcomes there, okay? Is it going to impact how the program is implemented here, okay? And or is it going to impact what will happen after this when you either want to scale up or out the project? And I might even add to that for its sustainability. And often the key issue there is just the intensity, the cost, the resources that are involved there. On the bottom, again, this notion of multiple perspectives. I think I like to say, multiple, okay, multiple points in time, multiple methods, multiple perspectives. Next slide. Okay, we're going to switch now and focus a bit on analyzing the data. Some of this will be maybe a teaser, and you can ask more questions because of time. We're just going to kind of hit the high points so you understand some of the key methods a little bit. Maybe we can talk about some of the pros and cons. Some of these are pretty well worked out. Some of them are, frankly, I think, real exciting. and kind of cutting edge, but I at least wouldn't be able to pass the test on the details of them. So let's take a look here. I won't read them all here. Erin, that's going to come up after me, will be able to tell you maybe a fair amount, or at least answer questions if she doesn't have that, about the top three, the more qualitative ones. I think the most frequently used one, and very useful, I think, is just in the center there, descriptive statistics there. How often was a certain type, of adaptation made there? And then consistency across different settings, different staff members. Often, I think people are using kind of more straightforward linear analyses or comparisons, something like a t-test or even a non-parametric. I'm particularly excited about, probably because I don't know that much about it and it's the grass is greener, but about configurative comparative analysis. And I think you might have had some other talks on that, but I think that helps us get out of some traditional boxes that we put us in, and are particularly nice when you're thinking about, you really need a combination of things always. It may not be just one type of adaptation, but if you have a certain type, you may need when that's paired with a different type of adaptation. I'm excited about the potential of that. And then again, broken record, mixed methods to interpret it. Next slide. Okay, so here's one way now, this really wicked problem of trying to think about the impact. In the next slide, I'll talk about some more sophisticated ways that may or may not be possible to do that. But often, I think, particularly for looking at a short-term proximal impact, you just need to ask people. Okay, and there are several ways. This is one that we've used. There's some different ways to do that. This is more in a survey type format. You can certainly do this in interview, or Borsika and I have been using more recently, just like with team check-ins with the implementation team when you're meeting regularly, just kind of some open-ended questions to do that. So, but this is one semi-structured way to do that relatively simplistically. And the other issue in terms of looking at impact that always comes up is shown in the first option there, about too early to know. Again, it depends on the adaptations, but many adaptations take a while from the time when you first start to when you see the impact. So you need to think about the timing of when you look at that. And often we do see this as we just tried, it's too early to tell really what the impact is going to be. Next slide. Okay, so one model that's used to help guide this is called the MADI, Model for Adaptation, Design, and Impact, by Drs. Kirk Moore and Wiltsley Sturman here. And the general concept behind that is to think about these three different domains in analysis. The first one is the characteristics of the adaptation. The second one is to think about, well, how does this work? Maybe the mediating, moderating, or potential causal factors or determinants there. And then finally, the outcomes. And I think that's important when we're also looking at what's the impact of an adaptation. It can impact the intervention outcomes. It can impact the implementation outcomes to make something be able to be delivered more consistently. And you need to think about all of those issues. Next slide. Okay, so here's some study designs. And again, I think this is a hot area. And if you maybe are fortunate to have a large scale project that works out and some grant funding, I think there's some real innovative and much more definitive ways, rather than asking people, about adaptations, to try and do this. Sometimes, but not always, you do need to know what the type of adaptation you want to study is in advance. But if you can, one way to study a number of different types of adaptation is to use a MOST, or multi-phase optimization strategy, where you kind of cross factorially in a factorial manner a design there. On the top right, I think this group is familiar with rollout implementation optimization designs, or some people call related issue about a stepped wedge design, where you systematically introduce adaptations at different ones. I'm kind of a fan of, at least on the bottom left, a variant of, maybe you could say a sloppy variant of a SMART design trial. And the way that works is you do initial intervention, usually have a randomization to study one factor, but then you assess how things are going over time. And then based upon the level of success, the sites or individuals, they're having success, often leave them alone for trying to be pragmatic and not doing that. But if you're not successful, then you might think about a further randomization, okay, or different types of adaptation there. It's often more feasible to do PDSA cycles there, or just a learning evaluation that's maybe a little less structured, a little formal. But again, not one study designed that's always optimal or possible. But again, I think this might help us nail down some of our scientific conceptual knowledge in the future. Next slide. Okay, so I'm just going to do a few reflections here, and then we're going to pause. I'll ask Borsika to help me and others to see what's gone on in chat. I haven't been able to monitor it and what we want to talk about. But again, a type of summary, then I'm going to turn it over to Erin here, is that almost inevitable. Brian Mittman likes to say, whether you like it or not, or whether you pretend it doesn't exist or not, or whether you try to suppress information about it, in any complex intervention, you're almost always going to see adaptations. So maybe we should be honest or upfront about trying to document these. Okay, guess I combined the first two talks there. So I hope you've gathered, and probably even selection factor joining this talk, is that you appreciate some of the need and the opportunities to better document and understand the impact of adaptations there. And then sometimes we like to hang our group hat called about pragmatic researchers' approaches to use of pragmatic models, measures, and methods here to document adaptations. And we feel even if you can't do it perfectly, okay, that's better than not documenting adaptations there. I think that, Borsika, do you recall? Yeah, that's, why don't we maybe go back to that one to hold that slide? Well, no, let's do it. Let's do what you just did. Take it out so we can have discussion with people. So I'm going to ask Borsika, you are our other co-host here, to kind of start the discussion out here and what's come up in chat.
Wonderful. Russ, I am actually going to bring it back to you, because there is a really great question about how to deal with the tension between having multiple methods, which is ideal, and then having too much information in various places ultimately analyze in a process evaluation. So how do you think about that balance?
Well, the first one, thanks for giving me the hard question. You were doing it, and I presume that it depends isn't going to satisfy either you or the person that asked it there. I guess I would say at the end, it depends on how important it is. And one example, what I mean there is if it's a grant proposal, and that's the key thing that we've promised to deliver on this, particularly if we've focused on key methods, then it's really probably important. Like most things in life, I think after you've had some experience, you get a feel with it for which methods may be the most useful of the 12 or 13, and we probably forgot some that we put there, are going to achieve that kind of that balance that you're looking for, okay, between the quality of the information that you get and what the burden is. I guess in an ideal world, I think it's nice with this notion of perspective to be able to get some type of reporting from the implementing team or staff and some from the research team. Often they have different perspectives and that sort of thing there. But we clearly can be overwhelmed. And again, I think the probably most systematic thing we have is the frame and the experiences there. And I'd say I'd have to agree with this, is just, you can't do everything. And so they have options and things there, clear ones. So I know I'm kind of dancing around that, and it does depend too, but to give you an example or a type of thought, I am a big fan that Borsika talked about of process maps. And I like those because I think it's a nice way of talking with actual implementation teams. Most people get that. They know that there's a series of steps or a workflow or a process, and then going through and understanding what that is, particularly before you do the intervention, after, and then how that has changed, kind of probing about that, I find really helpful. So then I'd ask myself, if you decide on, like, kind of, if you will, a core, most important one, what other methods are really going to be most likely to add to that or give you different types of information?
Thank you so much, Russ. I was thinking about what you are saying, and the different studies where we try to do adaptation documentation, and also different teams. And so specifically with our Moonshot grantees, we have these geeky teams where we have this great interest in adaptations, and we do comprehensive work, and we want to understand the depth. And then there are teams for whom adaptation tracking is an add-on. That's not what they came to look at. And so I think that where we have to find that minimum amount of information that is useful enough, I would say that the least burdensome might be, and I'm going to say that seems to work and generally resonate with people, that if you have discussions with your implementation partners, include 1 or 2 questions regularly about what kind of things that you found challenging over the past month.
I don't know if the rest of you have lost Borsika or not. She warned us that there might be a bit of an internet glitch there, but it does look like it was just a few seconds. And you're back now. Yeah,
okay,
you froze.
I apologize. Thank you so much. We were preparing for this happening. I apologize. So I was just saying that perhaps the lowest burden is to include a couple of questions in your regular discussions with your implementation partners to ask what kind of things were challenging over the past month or whatever time passed since you last met. And did you make any changes to the program to adapt to those challenges? And with that, you can get really a low burden way of interacting with them, but gathering information about changes. We find it that often just allowing them, giving them permission to share those changes will allow us to learn about them. And that could be perhaps the low-hanging fruit there.
That's great. And before people ask me another question I don't know the answer to, maybe we should turn to Erin to make sure we have some time at the end to both let you two finish and then to have some other good just kind of summative discussion at the end.
I am enjoying this so much. Thank you both for putting this together. It is, as was said in the chat, it is so comprehensive. It is so thoughtful. It is so needed. It's just really wonderful. So I'm not sure now, do I control the slides at this point? Okay, no, I'll just say next slide. So I think this is a perfect place actually, and I'm sure Borsika did this on purpose because she's so elegant and articulate in these things. Please go to the next slide. So I will say periodic reflections really came out of this tension and knowing we needed to have a better sense of, I feel like in qualitative methods in implementation science for a long time, we were very good at what happens before implementation, and we were very good at doing post-implementation when it's all over interviews to find out theoretically what happened during implementation, but we weren't actually talking to people very much during implementation itself. And we know that retrospective recall isn't fabulous. So from a data perspective, it wasn't terribly satisfying. At the same time, I work primarily in VA. We are often doing very large implementation rollouts, some of which are funded as research trials, and some of which are funded more as quality improvement initiatives. So we have a varying amount of control in terms of what sites are doing. So we have to be very pragmatic, and it's a good discipline in many ways. So periodic reflections really came out of the need to be able to have these conversations with our implementation partners. And what we realized was if we were able to have those conversations regularly enough and how often that needs to be can vary, and we'll talk about that, but regularly enough that we were able to have a sense of what they were doing, what challenges were coming up, what they were doing about that. We were able to get a tremendous amount of information in a way that people didn't seem to mind. So speaking to that burden issue that has been talked about. So this is something that we have started doing on many of our projects. We do usually include it as part of a constellation of other methods as well, and we can talk more about that. But the basic idea is so simple and very adaptable to different kinds of studies to meet different kinds of needs, but they're typically just phone calls, approximately monthly, because there's something about talking with people regularly that not only gives you more systematic data in terms of time periods over the course of implementation, that's very valuable, but also builds an enormous amount of trust and psychological safety. So people get more and more willing to open up and say, yeah, well, we started out doing this way, but actually we've started going in this direction, and here's why. And that data is just absolutely gold. So let me just say, the whole point of these is we have a template for the questions we ask. We keep that relatively consistent, but it's also pretty unstructured. The main topics we often go over are main activities. We always ask about kind of what's been going on, how's it been going. We do sometimes ask specifically about adaptations to the intervention or adaptations to the implementation, and those questions are part of our template. But I will say, after you've done this with folks for a few months, those often start to come up before you ask about them, so that's lovely. And then we also often ask about stakeholder engagement, and very importantly, what's been changing in the environment that's been impacting what you've been doing. And again, after you've spoken with people a while, they tend to have a sense of what the flow of the conversation is going to be, so they'll come back to these things. So that's the basic structure of what we ask about. Can we go to the next slide? Okay, so we don't need to go into a lot of detail about periodic reflections, and there is a quite long, in-depth training that the Hub did last year that I know Elena has put on YouTube. So there's a link for those who want to go full into periodic reflections. That's available. But the brief things to know are that you do need a discussion lead who is skilled in qualitative research and implementation science, because this is data collection and management, and the content questions are quite open-ended. So having a sense of knowing when to prompt is really important. That is important in terms of having a trained lead. Next slide. What's really precious about this that I just love is the fact that the participants themselves in the reflections can vary to the needs of the study or the initiative. So they do work best with a smaller group. I think more than about 5 people gets a little unwieldy. You do want folks who are really closely involved in the implementation effort, and very much aligned with what Russ was saying. Ideally, if you can be talking to the research team and talking with the folks on the ground, your implementation partners or your partners at the sites, so you're getting different perspective on what's happening and what's going on. Just to know that you want the folks who are either involved or really have a good seat to be watching what's going on and can speak to not only what people are doing, but why they're making any of the changes that they may be making. Next slide. Again, I would say that the key thing here is the fact that these are repeated over time, both because you are then able to look back and see when changes were being made, but also because there is such a time sensitivity to these things. We do not talk about things in the moment the same way we would talk about them 6 months later. It's just how we work. So we need to be attuned to that in understanding the quality of the data we're getting. The basic rule is that we want to have these occurring more frequently when there's more action going on in the implementation. So if there's a lot going on, a lot changing, Russ had said earlier that sometimes in the early phases of an implementation effort, that's when you have a lot of change occurring. And that's absolutely something we've found to be true. But they can also continue on, that change keeps occurring over time. And we may not know that if we're not talking to people to find out. So it's been surprising to us what we've learned in the process. Again, time sensitive to events. If you have a staff member leave who is critical, that can really shake things up, and that would be a good time to check in and make sure that you're doing a reflection relatively soon thereafter to understand how that might have changed what's happening. And of course, the key question is always about one of the reasons these work so well is because people don't seem to mind doing them after they get used to them. So they keep coming back. We haven't had a case where people drop off too much, because if you keep it short enough, if you keep it pleasant, and if you keep it so that people understand why you're doing it, burden and buy-in aren't too much of a difficulty. Next slide. The other great thing about these is what we end up typically with is either a transcription of the call or most often just near verbatim notes, as best the note taker can do. And they can be analyzed in many ways. So it can be an ongoing process, it can be periodic, it can be retroactive. We've done it more coding for emergent themes, sense making around adaptation, or deductive. We've coded reflections and the adaptations that come up using both Frame and Frame.is. You can do case studies. So you can that gives you a data source that you can approach in different ways. It's atheoretical, so it's quite compatible with a variety of frameworks. And it can't be part of a solely qualitative approach, but really I like it best, very much in line with what Rob was saying, as part of an integrated mixed method approach. Next slide. So I just want to give two quick examples of different ways of approaching the analysis, because I think it helps to visualize what can be done with these as a method. So this is just an example of taking a bit of text and looking at it and to understand what's happening. This was a study where we were implementing a psychotherapy intervention, really. But it has a screen component. So the provider and the patient need to sit and look at the screen together. So this is where the care manager who's delivering the intervention is about 3 months after the launch saying, oh, I'm getting much smoother at the intervention. But proximity, sitting close together, is an issue for some veterans. You don't usually just pull up a chair close to someone you don't know. So that's why part of why I spend a little less time doing the computer part, and maybe I'm partly adapting without thinking about it. And what you hear here is this isn't necessarily, she actually uses the word adapting, which I don't hear that frequently in reflections, I will say. But you hear where she's got a barrier. She's in an office. She feels like she's having to sit very close to her patients. And she's starting to do a little bit less of what was considered to be a core component of the intervention. And as the months go on, she gets to a point where she's using the computerized part of the intervention almost not at all. So we were able to see over time how that was evolving. So this is a very case study focused, very intensive understanding what's happening with an individual provider. Next slide. Another way we're looking at this is really trying to step back, look at the full course of implementation, and then start to bring together these pieces. Earlier, Borsika and Russ were talking about context and strategies and adaptations, and how do you put this together with outcomes to really understand? And I feel like we have so much room for growth in this in the field, so it's really exciting. This is some work that Julian Brunner has been leading and has continued to develop on since this presentation at D&I. But it's really trying to say, okay, if we look at when adaptations to the intervention were occurring, or when there were adaptations to the implementation strategy, and then we look at our key implementation outcome, which in this example is REACH, in terms of how many women veterans received a cardiovascular risk reduction template that was in the electronic health record. We can see when we implement a clinical reminder, which was the adaptation to this template, we do see a steady increase in REACH over time, but we also see that that drops off at a certain point. So then we have to follow up and try and get more information about, okay, what then happened that this looked like it was working for a while, but then it stopped working? What do we need to know about what else was happening in the context that can help us to understand these impacts and these associations and relationships? Next slide. Just to quickly note the limitations. Reflections, even though they're quite low-hanging fruit, they really are as a method. It's simple, it's doable, it can be flexible to different needs. It does require time and commitment and buy-in from the folks you're working with. It requires trust and psychological safety. If they think you're watching in a way that doesn't feel comfortable, they're not going to tell you things. It's not good for things where you need an adaptation log or you need that precision of dates or specification. Borsika was talking earlier about working with a geeky team. If you have a geeky team to work with, that is fantastic and can really allow for a whole different kind of analysis. So this is good for many things, but it's not nearly the same. And of course, I come from an ethnographic background, so I'm aware that this can't replace direct observation. Of course, there's always going to be a gap between what people do and what people are describing about what they do. So we always have to be mindful of that as well. Next slide. So, but just to say, this can be a very pragmatic, low burden method for capturing adaptations during implementation. The wonderful thing about it is you get a lot of accompanying data about what people are thinking as they're making these changes. And they work beautifully when you're working with teams or sites or folks who may not think and talk in implementation science jargon. I am very nerdy about implementation science. I love it, but I have had too many people tell me after I said something I thought was very smart that they had no idea what I was talking about. So not everybody speaks implementation in the way we do, and we don't want to not learn from what they're doing because we don't all speak in jargon. So this can be a wonderful way of getting a sense of what people are doing without requiring them to learn a whole new language. So that can be really wonderful. And this works well as part of the mixed method evaluation and can be tailored to the needs of whatever frameworks you're working with. So handy, but it's so lovely getting to see this larger conversation. So let's get back to it.
Thank you so much, Erin. I am so glad that you were able to join us today. I think that this is beautifully bringing together all the thoughts that we had. I'm going to stop sharing just for a moment to see whether we have one question, and I'm going to advance the slides for full transparency to a last couple of closing slides so we can have more discussion. The one piece that we are not going to include today to allow for more of the interaction is an example, and the example has been published and you will receive the slides related to that. I don't think I would be adding too much of my discussion. They are really just representing all the thoughts that Erin and Russ shared so far and myself earlier. So you will be able to access those. But while I am advancing slides, let's see whether there are enough questions or any questions we want to identify. And Julie had a question about worry about sites or participants whitewashing the reasons for adaptations when checking in monthly, and how do you account for that? So I don't know if Erin, you would like to take that, and then I will get ready these slides.
Oh, I'm happy to talk about that. I mean, honestly, I will say, so when we sit down to set people up for it, we'd love to do these reflections with you if you're willing. This is what this looks like. We do not own the primary purpose of reflections includes, but is not limited to, adaptations. Because we're trying to understand kind of everything that's happening. What's happening in the context? What are you doing? What's working? What's not working? And adaptations are a part of that. But because and I think we are very genuine in that if it's not working, that's great. We want to hear all about it because we're all learning all the time. So I think that really helps with the urge to whitewash, because people know that whatever they say is actually really helpful and welcome, and there isn't too much focus on it, so it doesn't become quite as tense.
Erin, if I may add to that, so one of the major concerns we had was the same, that people will feel uncomfortable saying that they didn't do something differently. And what we have found in at least some of our work, that implementation partners are not that shameful about knowing that change needs to happen on the ground. It's more the research team and how we approach it and our own feeling of shame of, this is a deviation from the protocol. So we found it most helpful if within the team there is an agreement that adaptations will happen and there is a permission to talk about them and not make them a secret or a undesired situation. So I just love what you shared, that I think people generally feel okay about it when you make them feel okay about sharing this. Russ, is there anything else in the chat? Okay, let me just quickly share a few resources with you all. This is, I have to make this into, so a few things that you might want to check out in addition to what we have shared so far. There is some tremendous work being done in the UK, and I would say that they have done a series of studies engaging with different partners, reviewing the literature to create some guidance around how to do adaptations. Most of the work that they share is related to guiding adaptations, but there are some pearls there about the documentation piece as well. So they use the EPI stages, if you can see in their little wheel here, and they have some really thoughtful considerations about how they define context, how they define interventions within context. They actually talk about interventions being an event within a context, and we are trying to change or accommodate that context at that point in time. So just really good writing. We have a number of papers that we recommend from this group, and I will show you, we have a nice listing. Someone who we mentioned a few times today was Shannon Wilsey-Sturman. Her FAST lab at Stanford has done really a lot of work in thinking about frame-IS and applying them, often in the context of clinical and psychotherapy interventions, but even beyond that. So if you go to their website, you will find some coding sheets, worksheets, further help to use frame and frame-IS and more. And then finally, this is a document that we made available this morning. Claire helped me just in time, which is a kind of annotated, I would not say, but it's a compiled list of various adaptation-related publications. Initially, it was created by a team, and you can see there when we did a workshop for NIH. And then just this month, a few days ago, I started to update it. So there are some newer publications added here. Feel free to download it. It's about, I don't know, 6-7 pages. And it has topics around planning, documenting, and other areas. So please feel free to look at these, and you will find many of the publications we mentioned in these slides, including Erin's publication about periodic reflections, some of the methodology that we used in the VA, and the study that I am not sharing. Finally, if you are very excited about adaptations at this point, which we hope you are, there is a group where we have been gathering nerdy, geeky people, us interested in adaptations, which is open to you all. So if you are interested in joining, this has been originally running under the aegis of the VA, and we are transitioning to a little bit broader platform as of September. So at this point, what you can do is to email us, and we are happy to add you to this listserv. And in our next session with the renewed kind of featuring, will start in September. Again, a very open group for work in progress, questions, or journal clubbing. And I think that with that, we can go to questions. Hopefully, we were able to pull some and from the chat, and I also have some from your registrations. Here is information about how you can get in touch with us. So I will stop sharing and open this up more broadly. We have still 6 minutes, so let's see. Russ, what did you find?
Well, as usual, David Goodrich has a stumper question for us there, but a really good one about those of you, if you know or dug into frame or some of the literature, makes a distinction between adaptations and modifications. And David's asking, is this important and to try and cover that? Or is this just an academic nuance and things that it really doesn't matter or gets in the way? And I have 3 different answers to it, and then Borsika will give you the right answer. First of all, to me, I wouldn't ask that on methods that directly kind of ask the implementation team to respond to that. I think it's maybe a bit too nuanced or whatever to get in with them, at least directly. You can code, I think. Second, if you can, it never hurts to collect more information than you may end up using. So if you can do that, if you can code it reliably, then I think, yeah, go ahead and do it. My third answer is, this is just solely personal. If I have to give up something, I mean, this wouldn't be the last thing that I would give up, I would say. But I think, you know, can be helpful, but to me, that's not the most essential thing there. But I don't know, we could go on and on, but I'll turn it back to Borsika, or maybe Erin wants to comment briefly too.
It's a challenging question, and Erin, please come and save me. I think that personally, I found the distinction pragmatically less important in our work, and allowing people to think about changes in general from the data collection perspective worked well. when we get to the analysis piece, I don't know, there might be reasons to think about it. I have not done it in our work yet. So it's a great question. And I think we have to continue contemplating it. Russ, if I may respond to one pragmatic question, who people should email about getting on the listserv. I would like to ask that you actually send your email to the disc@ucsd.edu email that Claire is going to monitor for us and help me collect the names, because that might get lost in my inbox. And then we will add you to the listserv. So thank you so much. And then one question I wanted to bring up that came in during the registration, and I would love to hear from everyone on the panel what you think about it. How can we use adaptations and the science of adaptations to address health equity? And Russ, you alluded to some potential ways that we can do this, but perhaps we can have a little bit more discussion about that since it's such an important topic.
I'll toss out a couple things, then be sure that others probably have more informed opinion. I would say two things I like to think about are representation and representativeness. And what I mean by that is I think being sure that you have the important community partners to hear their voice on it. That includes both people doing things and people that are going to be impacted. So when you're setting up this system, like anything else in the spirit of team science, I think having that representation is one that can help. And that helps with even setting up the coding, and what do you code? And then the other issue I would say is looking at when you're coding these adaptations, again, thinking this issue about who's involved, where does it happen, and then the impact is maybe even more important. So that representativeness of the impact of the adaptation.
Thank you so much, Russ. I don't know if others would like to join in from the panel to comment on this. I'm trying to be not coercive. There is a question from Claire that I think would be a nice way to close our discussion, Russ, and it is basically inquiring what are you most excited about with the adaptation field, and where do you see the field headed next?
Do you want to start? You want me to toss out? Who do you?
Why don't you, Russ, and then I can add if I have anything.
To me, it's the thing that Borsika wouldn't let me talk about today. It's iterative use of adaptations and actually using some of this information and things and making adaptation as you go along, rather than waiting till the end and say, oh, I wish I'd done it, or these weren't good adaptations.
I would agree with you, Russ, that perhaps the most exciting part is what we kept as a secret in this presentation, but perhaps we'll come back or we will have other platforms, is thinking about how we can use the data that we collect about adaptations in a way that we actually advance health equity, that we actually improve access for those who are most in need, that we don't waste funds of research, of doing the thing that is not working, and feeling comfortable of making change as needed as we go along. I think that that's the hardest thing to see, that we complete an intervention without changing it just to accommodate the design and not look at the data and make changes as needed based on preliminary information or process information. So I agree with you. That takes us right at the end of our session. I am so grateful for the very active participation from you all in the chat. We are going to save the chat, and again, hopefully we will have other places where we can meet with you. And Erin, Russ, thank you so much for doing this, and everyone in the background who were running this so smoothly, thank you.
Thank you all. Take care. Have a good weekend.
Thank you.